Today we are going to discuss about the echogenic focus, little echogenic focus in the kidney, whether it is sinus fat, whether it is tiny calculus, or whether it is concretion. Dear colleagues, Assalamu alaikum. إياك نعبد وإياك نستعين اللهم صل على محمد وعلى آل محمد وبارك صلى الله عليه. I'm Dr. Sultan Ayub, working as a radiologist. This is a young male patient with pain in the right renal area. Here we can appreciate this echogenic focus which is present at the lower pole level. And this echogenic focus is like this, like this, like this, like this, like this. So this echogenic focus is having almost same echogenicity with the adjacent tissue. So what is this echogenic focus and what are these echogenic focus which are somewhat linear, and so we are now discussing about it. First, whenever we find such a echogenic focus which we suspect that it is a tiny stone or it is a renal sinus fat droplet or a concretion. So here we are suspecting this tiny focus. What is this? If we closely observe, this tiny focus is definitely showing posterior acoustic shadowing. So when we see such kind of finding in the kidney, we can definitely say this is a stone. Always remember that stone must be present in the calyceal system or in the papilla of the urinary bladder or in the renal pelvis or in the minor or major pelvis. It will not be present in the renal sinus fat. So definite location of stone is within these collecting system, calyceal system or the papilla. So this is the one informative thing that where it should be present. So when we talk about this focus, this is giving the shadowing, this is definitely a stone. And other confirmation, we apply the color. Look here, we have put the color and these are the vessels and this is the twinkle artifact. What is twinkle artifact? The Doppler machine generate the such kind of rapidly changing colors when it strike on the highly reflective surface that is irregular and rough. So this will produce such rapidly changing colors which we call it twinkle artifact. Look here. So now I am going to remove the color. Look here. So this was the portion or the tiny focus which was producing the twinkle artifact. So this twinkle artifact greatly support the diagnosis of the calculus. It is not a definite criteria, but it support the. So what we have seen, number one, echogenic focus. Number two, present in the lower pole. This is the calyces, lower pole calyces. Number three, it is producing the shadowing. And another is the it is giving twinkle artifacts. So these are the four supporting clues supporting ultrasound findings. So we can definitely say it is a tiny stone in the lower pole calyx. When we call it tiny, we can say it microlithiasis. Tiny stone is a general term we can say in the reporting macrolithiasis. Whenever we talk about the tiny stone, we should always tell the location of the stone so that the urologist should be aware of the definite location of the stone, number one. So, and we have seen that when we put the color, these are the sinus fat. This is also echogenic focus. This is also echogenic focus. But we can appreciate that these echogenic focus are continuing with another focus, another focus. These are not discrete. This is the renal sinus fat which is surrounding the calyceal system. This is black is the calyces. So this is surrounding this calyceal system, and also this may be the interfaces of many other things. This is the focus which is irregular in shape and it is producing twinkle article. So again I am now going to see it in the real image. So we have seen this echogenic focus. Now another, and we can appreciate this is the black area. It is the calyceal system which is dilated, and this echogenic focus is present in the lower pole calyx, this one. Now we are now. So what we have seen that this echogenic focus is present in lower pole calyces, and this is the pyramids, medullary pyramid, and this portion which is in continuity with the calyces, this is the lower pole calyces, this is the papilla. Here also echogenic focus, which is the definite stone or calcification, may be present. So this is the another place for the stone or calcification, and so first is the calyceal system, lower, minor, major, and renal pelvis is the place for the stone, and another is the this apex. This is the apex of the pyramids, which represent the papilla of the pyramids. Here also, here there is an opening from where the urine come into this, and also the stone may slip from here into the here. So this is another place for the stone. Now look here, we have seen this. This is also the color mixing, and I am now removing the color box. Look here, this is the another echogenic focus which is present in the minor calyces very close to the papilla. So this is another tiny stone, we can call it microlith. So what we have learned that when we see the echogenic focus, it should be discrete and it should be examined in the different plane, longitudinal, transverse, angling the angling the probe, tilting the probe, and then we see that echogenic focus is fixed. At that has the same orientation. Then we can say that it is a tiny stone. While when we will move the probe in different direction, longitudinal, transverse, angle, tilting, focusing that echogenic area, then if there is a sinus fat, so look here, this is a sinus fat, and this is the sinus fat, this is the sinus fat. Although now it is a prominent pelvic calyceal system, so it has displaced the renal sinus. While if there is a no prominence of this calyceal system, it will not have such orientation. Then we should take the help of the probe handling. Look here, this is the echogenic focus, but it is not present in the calyceal system. It is not present in the collecting system. So it is not a stone. And when we are not confirmed that echogenic focus is a definite stone or a renal sinus fat, then we can say it indeterminate echogenic focus. And don't, in my opinion, don't force yourself to diagnose the calculus if it is not confirmed. You can write the indeterminate echogenic focus in the renal sinus, so the tiny stone cannot be excluded. So you can write in this way. Now I'm again the word I will talk about the word we use, the concretion. Sometimes in the ultrasound reporting, we sometime I'm talking about, we report the tiny calculus or echogenic focus as a concretion. So in my opinion, this is a non-specific term because concretion means it may be tiny calculus, it may be calcification, it may be echogenic renal sinus fat droplet. So this may mislead the urologist. So I would like to avoid this term concretion as a alternate as a substitute for the tiny calculus. So always try to use the tiny stone, sinus fat or indeterminate echogenic focus. So in my opinion, concretion is a non-specific. It may be used for the calcification in the pyramid, in the cortex, uh, and it may be used for the sinus fat, may be used for the tiny calculus. So look here, this is given the posterior shadowing, this one, and this is not given the posterior shadowing, but it is given twinkle artifact present within the calyceal system. And this is not stone because it is continuing with another fat. So this is the fat droplets. This was all about the echogenic focus, whether it is a stone, sinus fat, or we can use the term concretion, or we cannot use. In my opinion, try to avoid this term as a substitute. I can measure this one. This is 4.2 millimeter in size. So in the report we can say that echogenic focus with posterior shadowing and twinkle artifact located in the lower pole calyces is consistent with the microlithiasis. Thank you very much.